My name is Mary Ann Oaks, and I'm the complex abdomen specialist at Regions Hospital, which is a level 1 trauma center in St. Paul, Minnesota. And I have a passion for fistula care. I love necrotizing soft tissue injuries and other big wounds. I kind of have a new love of orthopedic wounds, which is super fun. All of them have challenges. I started this YouTube channel to kind of talk about some of the things that we do at work that I thought could help out other people. If you want, you can subscribe to this YouTube channel. It's kind of fun. So I'm going to start today talking about the use of this machine, which is the 3M's Ulta, which is an amazing pump. It can do so many different things. And I just thought that it might be helpful for people to see kind of the setup of the pump and then how you could put a really simple installation VAC dressing together. This is what we're talking about today: negative pressure wound therapy with installation using the 3M Ulta Pump, and how to set it up and how to put together a basic dressing. My objective today is to figure out who gets this kind of therapy, how to use the VAC Ulta Pump, the parts that go with it, standard setup just right out of the factory, what Veraflo or what installation is and how it works for the wound, some small troubleshooting, and then just use of the software like the therapy and the alarms, and then the secret pen, which is super fun. So whenever I come to a patient, I'm like, okay, this patient needs negative pressure wound therapy with installation. And so the first thing I think about is, what does the skin look like around it? If it looks totally healthy, I just use a drape right out of the kit. If it doesn't look healthy, I like to use that new silicone hybrid drape called Dermatac. And it's like, it's gentler on the skin. And then I say to myself, does it need to be debrided or at least cleaned up? Is there debris in there? You know, and if the answer is yes, I obviously will have surgery, take a look at them. But also I would like to use this new waffle foam, and then negative pressure wound therapy with installation. And I'm always thinking about home, when they're going to go home, what they're going to do. Can we do standard negative pressure at home? Do they have a home? And do they need to continue with installation? Because there is a VAC out there that's approved for home care that has fluid installation or irrigation connected to it as well. Or do they just need an advanced wound dressing, something that can handle the exudate and also is comfortable, and we can get someone to change the dressing, or they come into clinic or whatever, how we're going to handle that. So the items you need to start the installation therapy is this cassette. The factory calls it, 3M calls it a Veralink cassette, but it's the installation fluid cassette, or it's almost like the IV pump side of the pump. And then the canister is on the other side that collects the fluid. You got to decide on installation. I love Vashe, and so I hang Vashe most of the time. And then the foam dressing, like what kind of dressing do you want to use? So negative pressure is deployed, and then pump is programmed to instill fluid and let it soak for a little bit, and then start back up without you pushing any buttons. And so it's kind of like this ongoing cycle of soaking and then the negative pressure going, almost like a washing machine. So the capabilities of this pump is crazy. You can have fill volume, soak times, installation cycles, and negative pressure kind of all over the chart. When you turn the pump on, it's preset with a 10-minute soak that happens every 3.5 hours at a negative 125, which is what almost all of the scientific literature published about this therapy. That's the settings that they based their science out of. And then is the question, how much to put in the foams? And I think everyone does it a little bit different, to tell you the truth. Medium dressings, you know, this is like the factory amounts from the factory manual, and the large dressing, you can kind of see them. But when I called a bunch of my friends that do installation kind of across the nation, and everyone said that at this point, they're just kind of doing clinician's experience. And I think I do the same thing. Medium dressings, I'm usually, you know, somewhere between 20 and 40 milliliters, and large dressings, I'm usually more like, you know, 80 to 120 milliliters. And so it kind of just depends on the patient themselves. Or you can use the Phillips function on the pump, which I'll show you how to use that. And then once you get your dressing filled, they suggest decreasing it by 20%. In the installation volumes, less is more. And then you have to make it easy for your clinicians and your nurses and care providers at the bedside. So we made it into an electronic medical record order set. And so everything that you would need to set up the pump is in the order. So this foam is different. It does not hold fluid. It lets the volume go through it. And you can see where this fluid going right through that foam and connecting where the wound and the foam interface. And that's exactly where you want this action to be, because it's the mechanical contraction of the out phase or the negative pressure phase that kind of fractures that softened debris and throws it into the canister, which is amazing. So strategic placement of the port is important. So gravity is your friend. Obviously, if you have like a wound on a chest or an abdomen, the patient's sitting up, you want to put the installation or the in port up top, and then the negative pressure ports down low. On posterior wounds, a lot of times we'll put the negative pressure bridge to the side, but you always have to think about gravity as well. So the new negative pressure ports, they call them Sensitrax, 3M does. People call them track pads, lily pads. They always were just a negative pressure or a sucking vacuum, right? Well, now we have this new installation port, which is the one on the right. It's really soft and pliable, and all it does is instill fluid, and then the negative pressure takes it out. And in the large dressing sets, they come like this with the installation in one spot and the negative pressure separate. In the medium dressings, they've actually attached these two together. And so it functions as one, which makes sense because if you have a smaller wound, you won't have enough room to put two, an installation and a vacuum port. It has to be combined together. So it took me months to figure this out. So I'm hoping I'm giving you this little pearl, because I would be like, what? I'd open these dressings. I'm like, now why did I get them separate this time? Until some nice person, probably my 3M rep, told me, oh, hey, the medium ones come combined. So, and there's no small dressings, in case you're wondering. And then whenever we have new therapy, definitely we have new alarms, right? And so the good thing is this pump is super smart. And if you have an alarm, you'll see the little triangle, the yellow triangle of death, and you're like, oh no, I got an alarm. Just touch the question mark. It's a touch screen. And it'll give you like helpful hints or a solution to the problem. So like this is the blockage alarm. So it goes through all the different things that you need to do for a blockage. There's also like instill alarms. And so like those are the kind of things, I just touch the question mark and like kind of follow the directions. And then one of the biggest things people ask me is, can you use more than one therapy unit per wound? And so these big wounds, kind of my standard of practice that I've been doing now is after I open my third large dressing, I call for another pump. And so like this patient had like 12 large dressings because it was a whole body kind of that was injured, and they don't all have to be simultaneous. And your mind is like, well, they all have to instill at the same time and then do negative pressure at the same time. Otherwise they'll alarm, right? That's what you would think. Well, that's not the case. It's like magic. They don't alarm. So we can put them all on one big wound, or, two of them or whatever you need. And they can run asynchrony. I mean, one can be in the instill phase and one is in the negative pressure phase, and they do fine. And so I put mine like a baseball field. So I put the installation port kind of, at the top of the gravity, and then the bases would be the negative pressure. And I'll do I like to Y in a couple extra negative pressure ports. I think it just seems like it works efficiently. And so that's just generally how I do it. And then the canister diagnosis, we've all gotten really good at using our canister to diagnose our therapy volumes and frequency. So the canister on the left is really what you want to see, just kind of seriously fluid. That's probably the right amount of washes and the right volume. The one on the right is pretty gunky. I mean, that's pretty gross. And so, the guy on the right, I would definitely increase the frequency or the volume to kind of get that washing more frequently or whatever, trying to clean up that wound more. And then my secret sauce, which is obviously no longer secret because I'm talking about it, is I love Catalan Advance. It really helps to kind of prepare the peri-wound skin for landing of the products that we need to put on there to make sure we get a good seal. Because in this installation therapy, during the soak phase or the instill phase, there's no negative pressure holding it on. The only thing that's holding it on is the drape and how you prepared the peri-wound skin. And so I put ostomy barrier rings around every single instill VAC, all the way around the entire thing. And then I clear drape over the top of it. And we're going to talk about how to do that in the demonstration phase. And that helps me to help, you know, these leak-proof VACs, even when people are up and moving and they're moving their dressing, you know, even though there's no negative pressure on there. And then good scissors. I just love a good scissor. And this is my favorite, not this particular scissor, but this type of scissor is my favorite for negative pressure systems. And then I just want to say, give yourself a break. I pulled the data from Regents Hospital over the past 4 years, and we put on 7,060 negative pressure dressings over those 4 years. And even though, like myself and my entire wound care team was super dedicated to instillation VAC, we were only at a 20% instill rate. So that means 80% of our patients were still in negative pressure systems that were non-instill. I think 2021, we're going to be at about 50% once I get the data. And I don't think we'll get past that because we do so much skin grafting. And the one thing you don't want to do is put an instillation VAC on a skin graft because it'll get it too wet because obviously that's skin cells, right? And so you don't want to macerate the skin cells, so you want to keep it dry. This is called the Ulta Pump, and it can do many different therapies. And when you turn it on, it should look like this. You should see all 4 therapies. The instillation is what's called VAC Veraflo therapy, VAC therapy, which is just regular VAC therapy, and then Previta, which is the closed skin incisional therapy, and then the Abthera, which is the open abdomen therapy. And so we're going to touch the VAC Veraflo. And so I told you guys that there's a secret pen, and so I'm gonna show you where the secret pen is. Right here. Boink! I bet you didn't know it was there. And so if you have chubby little fingers like me, then you can take out your little secret pen, and then it makes working through the touch screen a lot easier. So with this setting, when you turn this on, like just straight up turn it on, it'll always come up with VAC Veraflo, and then the settings will be a 10-minute soak every 3.5 hours at a -125. Its intensity is on medium. That's how fast it draws down. It doesn't really have to do anything with pain. It's how aggressively the VAC pulls the air out of the foam. And then continuous. And so you can say, you know, yes at this point, and it's going to try and get you a seal, right? And once it gets a seal, this is the new software for it looking for a seal. Then it'll give you a little indicator that you can choose your installation via autofill, which is where you push a button and you watch. We're going to do this, but you push a button and watch how much volume goes into it. But before we get there, we have to go back and do a couple other things. But you have to add your components. So this component, it looks like this. It's called the Veralink cassette, and it comes out of the package with a little white cap in it that you can hook to other bottles if you need to. And so the good thing is that it's got an orange flag and it tells you where to hook it to, if that makes any sense. But this is called the Veralink. It's not intuitive because we're used to IV tubing. And so what does an IV bag look like? It looks like this. You spike your IV bag and then your tubing goes, right? This is backwards. It's upside down. So it rolls in and it spikes the bottom from the bottom. I can't tell you how many times I've seen people trying to put this on like this because that's what we know, right? But it's actually the other way. So you're going to put it roller down and you just set it in, and then one finger touch, and then once you hear that click, you're good to go. And then your canister is the same as it always has been, but remember it's got these 2 little side guys that just give you trouble. They get in the way. And so you just want to put it in kind of at an angle, and I like to give it a little bump. Now you're ready to do your therapy. So this is the medium dressing. When you open it up, you've got your acrylic drape, and they always send some no sting barrier and a measuring stick, which is nice. And then you have your 3 pieces of foam, right? This is the one that is touching the wound. These 2 are used for different wounds that have different depths. And that kind of was a mystery to us at first. And so this is always against the wound bed. And then if you have a deep wound, you'll use this one, and a more superficial wound, you'll use this one. I can tell you that this is great for bridging, but if at the end of a bridge, you're going to want to use this to land your negative pressure on, because this is too thin and then it gives you alarms. So anywhere this device ends up, you want it to be landing on a thicker piece of foam. So sometimes that means we just cut a thicker piece and add it in. Then this is the medium dressing, so it does have that where it's combined. See, they're hooked together. And then you can see that there's the installation side on one side and then the negative pressure on the other. Some people have found that this gets has alarms because I think this just gets too gunked up. But sometimes you have to use this because the wound is too small and you have no choice. Okay, so that's the medium dressing. So let's look at the large. There is no small dressing, which is interesting. So here's your large dressing, right? Same thing. You have your acrylic drape. You have more, no sting barriers, a lot of them. Got your measuring stick. And then you have the 3 foams, just bigger in size. But then is your regular negative pressure, and your installation is separate. And I just pull these apart. It just makes it easier. You just kind of just pull apart. And it's kind of fun. So the cool thing is that they made it kind of bulletproof. So this orange tag meets up with this orange tag, which is really helpful so you don't get confused if you're not trying to hook, like this into this, that kind of thing. So orange tag to orange tag. Here's our wound today. It's in need of installation. I'm going to use the thick foam. I'm going to put this against the wound itself. If I had any areas like a little V or a little dip or something, I just take this and I just cut it, because then it'll sit, it'll sit better and it won't like hammock, because you really want it against the wound. And so sometimes you have to trim it so that it sits perfectly. But before we do that, let's do our peri-wound skin. Vashe, love Vashe. Wash the whole peri-wound skin and the wound itself, allow it to dry. These are those 7806 4-inch barrier rings made by Hollister that I love. I cut them into circles. And then this is probably the most important part of putting together an installation back, is getting the wound edges ready. So take your stuff, don't overstretch it. People love to stretch it. Set it back a 1/2 centimeter from your wound edge. I don't know if you can see it because this is all clear, but just believe me, it needs to be set back just a titch so you can see the skin sticking out between the barrier ring and the wound itself. And you're going to do this all the way around, right? And this is going to help that during that instill phase, there's no negative pressure, right? And that's when your patient gets up and goes to the bathroom and pulls off your dressing that took you an hour to put on. Okay, so we're going to finish our little circle like that. Move this over so it looks pretty. Okay, then if the peri-wound skin is healthy, I just use the standard acrylic drape. But let's say this peri-wound skin is not healthy, that this gentleman fell off his motorcycle and skid across the ground and all the skin around it is all beat up, right? Then I'll use this bubbly, it's called Dermatac Drape. Doesn't even say it on here, but it's got silicone in it, and it's very flexible, and it's really, really gentle on the skin. So if you have bad skin, I would go with this. It's sold separately. The putziest part of this whole thing is putting the peri-wound skin together, because once you get this all figured out, then you just kind of plop in your foam and you're off to the races, right? Important tip. I am going to hang my drape into the wound edge about 1 centimeter. So that does a couple things. One is if your cells are skin cells and they want to migrate across, your negative pressure foam won't kill them, right? The other thing it does is it really makes it a lot more comfortable when you take this down for the patient. It's like that little skin edge is where all the sensitivity is. And so kind of all comes off in one nice glob and it doesn't hurt as much. So now we are ready to put our foam in, right? So holy part goes against the wound. There you go, wound. I chose the thick contact layer today. So you don't want to have any wrinkles. I mean, normally we don't want wrinkles with our negative pressure systems anyways, but with the installation, you even more don't want any wrinkles, because during that soak phase, if you have wrinkles, it's going to leak. We have our foam inside of our wound. I'm going to cut this in a circle so I can put my trackpad and installation port. And then I usually try and, be scientific about where I'm going to put it so that it doesn't end up, tangled up with their Foley or whatever. So I'm usually kind of a lateral person. So then we have to hook up our negative pressure system. Ta-da. And then our installation. Orange to orange. It's got like a little lure lock in there. Ta-da. Our installation. So I love Vashe. You could use a normal saline bag as well. But the Vashe that comes with a cap that looks like this actually has a top that is meant to spike through. And so if you take this tongue off, that's your spiking area. Sometimes I will leave the cap on because it's a little bit more sturdy. And then when I spike through it and it swings around a bunch, there's no leaking. But for today, we're just going to spike through this. So you take this little guy off and then you're going to spike this. Some people say it's easier to do this without the Veralink attached, but I don't think it's that bad. Okay, so now you need a hanger, right? So if you lift up this little flap, this comes up and it turns out sideways. It turns out sideways, and then you lock it back down. And it can go taller or shorter depending on what you need, right? If you have a little bottle or whatever, you can make it shorter. And then scientifically on the back of this Vashe bottle is this nice little hanger. Ooh. And then it just kind of gets supported in this little holder. It doesn't really fit in here. It just kind of is supported by it. And I just wanted to point out too that there's a little vent here that you can open up so that your bottle doesn't get squished and get all vacuumed in. So the next step is to start the pump. And it's going to find out if we have a nice seal. And so I usually try to give the patient a little love. I kind of rub the edges, make sure that there's no air leak. And remember, if you do have an air leak, sometimes it's because you haven't gotten that canister in tightly. That happens to me a lot in the OR, especially when I don't put my own canisters on. I'm looking for a leak on the patient. I'm looking, and then all of a sudden I'm like, oh, it's the canister. So make sure you have that on really good. Once you have a good seal, and it takes about 2 minutes and 30 seconds, then it'll give you the opportunity to put some volume into your wound. So once you get to this screen, which says fill assist, we're going to hit the start button. Now the fluid is going to start to fill into our foam. So you can kind of see it on the backhand side, right? It's coming through and it's filling our wound. What the factory recommendations is that once you see the fluid along the edges of the foam, that's your volume, and you're supposed to decrease it by 20%. But we found that that volume could be ridiculously high, especially if you had a wound that was like a canoe or had any deep areas, right? So we're already at 55 milliliters, and you can see we're about halfway through. But we can't really see it over the top. And I think that's the problem with this technique. And in an upcoming session, I'm going to show you how you can bypass this. So let's stop here and we'll say, okay, 90 milliliters is what we need for this wound. And then you can just take your handy dandy little cute pen and then decrease it by 20%. So that would be what, 75 milliliters or so. And then you can say, okay. So now it's going to soak for this first 10 minutes, and you can tell it's soaking because here's the remaining time, 9 minutes and 51 seconds is still remaining. So it's going to stay in this soak phase right here. until that. And then the negative pressure will deploy and fluid will come out of the foam. It's timing down. And I don't have to do anything. It's going to do this all on its own. So when I get done, I can just walk away and let it start the vacuum itself. So now it's bringing the fluid back out of the wound after it's soaked it and putting it into the canister. So you have to remember that your volumes in your canister, you have to add the volume. If you have a patient on strict I&O, you have to make sure you add the volumes that you're putting in for the canister output so that you don't have your outputs thrown off. You can see the fluid coming back into the canister. If you need to pause this for any reason to do something with your patient, or if you want to switch out a canister, if you use the green start stop, it'll always go through that 2-minute and 30-second phase. So if you need to stop therapy, use your pause button. In a future video on the advanced setup of this, I'm going to show you how to bypass this so it's a lot faster and you don't have to wait for that soak phase first. So watch for the advanced setup of the Ulta Pump in our YouTube series. Okay, well, thanks for watching this video. I hope that it's helpful to you. There is a lot of steps to set up this type of therapy for sure. It's definitely worth it in the outcomes of your patient's wound. And so I encourage you to try it. Thanks for watching. And the next video we're going to do is the advanced setup of the VAC Ulta Pump. Have a good day.